Hey guys, welcome back to the clinic. My name is Hasan and I'm a doctor in the UK. In this episode, I'll be exploring medical ninjutsu and its similarities to real life medical science. If you enjoyed this content, please don't forget to subscribe to help me grow quicker than Hashirama's cells. In the Naruto anime, we are told that there are a special class of medical ninjas who specialize in the use of chakra techniques to heal others. As learnt in Boruto episode 152, when you become a genin, at least one member of the team needs to learn medical ninjutsu to increase the success rate of missions. Not everyone is able to grasp these techniques as it requires intricate chakra control, similar to how a real-life surgeon needs fine hand-eye coordination in a procedure. During the medical course led by Sakura, we learned that it's taught with both extensive knowledge on things such as herbs, medicines, and the human body, as well as a practical part of having to control your chakra. This really does remind me of how I was taught at medical school, where I learned both the extensive knowledge of physiology and anatomy and had classes on the practical skills such as blood taking, cannulation, and minor procedures such as suturing. One important technique taught in the academy is known as antidote. Here we can see that they can use chakra to separate two liquids. This is useful for separating poison from the part of the body it has entered, such as the bloodstream or organs. I presume once this jutsu separates the blood from the poison, it can be immediately extracted. Sakura explains that the reason for separation is that the two mixed liquids have different components which react differently to the chakra applied to it. A side note is that Chiyo in the past used her medicinal knowledge to create deadly poisons, however her efforts were often counteracted by Tsunades, perhaps maybe from the creation of this jutsu. In the real world, there are some tools we have that use a similar concept. For example, cells can be separated from each other using a centrifuge. A centrifuge spins the cells, separating them based on their mass. One example of its use is when blood is donated and the red blood cells are separated from the other components of your blood, such as the platelets. This makes it easier when transfusing patients with blood loss, giving us options to give the right types of cells for the right situation. In terms of separating substances from the blood, such as poisons that don't have a chemical antidote, one tool we can use in the hospital is dialysis. In simple terms, dialysis is where blood is made to pass by a semi-permeable membrane that separates the blood from a dialysis fluid. This membrane allows some substances to pass through, such as water, toxins, and waste products, to be removed from the blood into the dialysis fluid by a process called diffusion. In the Boruto course, we are also introduced to the healing jutsu known as the mystical palm technique. Here, chakra is concentrated onto the hands, then applied on wounds, similar to how topical antibiotics help quicken the recovery of an infected skin infection. This technique can also be used as a scalpel for surgery, as it allows them to make precise incisions and then double up to heal the wound. Users must be careful to only use as much chakra as needed for the specific injury. If too much chakra is sent to the body, it can disrupt the body's circulation, putting it into a comatose state. It can also be used as a weapon, as done by Kabuto multiple times in the Naruto series. Chakra has a unique ability to stimulate growth in life, which is also shown in the emergency life-saving measures, where applying chakra into a wounded person can resuscitate the individual. The only thing that comes into mind that is similar but not as useful as chakra in real life is heat. Heat, when applied to some living organisms such as plants, stimulates growth and is vital for survival of nearly all living organisms. But of course, it cannot necessarily resuscitate an individual and can be only mainly used for hypothermia. Furthermore, the mystical palm technique also resembles the medical technique known as cauterization. In real life, this is where you burn a part of the body to remove or close a part of it. Its purpose is to destroy some of the tissue in an attempt to reduce bleeding and damage and remove undesired growth and minimize potential of infections during surgery. Some final trivia is that according to Madara Uchiha, the first Hokage, Hashirama Senju, was able to use medical ninjutsu with such skill that he could instantly heal himself without the need of forming hand seals. Madara concluded that Tsunade paled in comparison, but after seeing her ninja arc creation Rebirth, strength of 100 technique, Madara deemed Tsunade's healing abilities similar to that of her grandfather's. The epicness of Hashirama Senju doesn't end there, because even after his death, his cells had an immense regeneration ability that requires no hand seals. These cells were heavily researched on and exploited by many characters of the Naruto universe. Being able to form limbs, their characteristics can be likened to stem cells, showing potential to form any part of the body. But it's important to note that to sustain these cells requires a great deal of chakra. Okay guys, that's all for now. If you enjoyed this, please spam that subscribe button and check out my social media. I'm on Discord and Insta, so if you have anything you want to ask, just join us there.